Thank you, Toy. Well, as you age, have you noticed a few more aches and pains than when you were younger? Well, most of us do. But what about in your thumbs? Do they hurt a little more than they used to when you do things like maybe opening a jar or turning keys? If so, it could be arthritis. Nothing to be alarmed about, doctors say, but you might want to consult with your doctor. Dr. Julian Carlo is an orthopedic surgeon specializing in hand surgery, and he joins us now by FaceTime to talk about this. Dr. Carlo, good morning.
Good morning. Hi.
I have a dear friend who has arthritis in her hands and a coworker who deals with arthritis, but I didn't realize it could base itself directly in your thumb. Is that very common?
Yes, it's one of the most painful places to get, or one of the most common places to get painful arthritis in your entire body. There's one joint called the thumb CMC joint. About 1 out of 3 to 1 out of 4 people will develop arthritis there over the course of their lives. It can certainly be all over the hand, but a lot of people will have a completely normal hand and just arthritis in one joint called the thumb CMC joint. And the goal starting out treating it is to improve your pain and improve your function. And there are a lot of conservative options that can help achieve that goal. What a lot of people do, or what I recommend doing, is taking anti-inflammatory medication like ibuprofen or Aleve, pain medication like Tylenol, wearing a splint on the thumb. Some people will benefit from having a steroid injection or a shot directly into that thumb joint that can provide some temporary relief.
A shot right into there, but does it last, or is that something you'd have to have repeated?
You can certainly have it repeated. It tends to last a few months. Sometimes I inject people and it lasts, quite a long time, a year. And other people, it just may not help that much, and they may be looking towards surgery or other options.
So when people are having the pains, is there something distinctive about it rather than someone just thinking they hurt something in their fingers or something about it that they would know it's arthritis?
Typically by location you can best identify it. It tends to occur right here at the base of the thumb, on this side or on the back side.
Okay.
Some people feel it being in the wrist or the hand. Usually pinching and gripping tend to make it worse, certain positions of the thumb as well. People often say that turning the key, opening a jar, writing, knitting, sewing, even texting will cause the pain to occur.
Well, I would imagine with the way as many people text today, does that add to the problem, or is that just where you'll notice it?
Yeah, it certainly can add to the problem. It's the accumulation of stresses over time on this joint is what ultimately wears down the cartilage.
Now, I know you're a surgeon, and so you would ultimately, if someone did need surgery, you could work on that. But when do you get to a point that surgery would be required?
Well, it's just a difficult decision. You have to make it talking to the patient and keeping their best interests in mind. You would like to have exhausted the conservative options, because those usually do help to improve your pain and improve your function. When they don't, surgery is usually the best option. There are several different types of surgeries that have been devised over the years. What I usually do is, and it's the most common surgery, is remove one of the bones called the trapezium in the hand. It's right here. And in its place, transfer some tendon to act as a cushion or a spacer. It sounds a bit odd, but it works really well. It has a good track record.
And what's the recovery time for something like that?
Recovery time is usually on the order of several weeks. People are in a splint for a couple weeks before they come out of the splint part-time, and most people will do some therapy. People can usually go back to work fairly quickly, albeit with some restrictions.
Okay. All right. Well, good information this morning, Dr. Julian Carlo. Dr. Carlo, good to see you again.
Good to see you. Thanks.
Okay.